right. I want to introduce our first guest, Mark Heggestad. Let me put my old lady readers on. Mark Heggestad grew up in a small town in Minnesota where he learned the values of fairness, hard work, and community that still guide him today. Now living on Jacksonville's South Side, he's a Democrat running for Congress in Florida's 5th District with a mission to level the playing field for working families. After decades of real-world problem-solving and community service, including 40 years as a football official and being a senior project manager in healthcare, Mark is committed to bringing honesty, teamwork, competent, trusted, and practical leadership back to Washington, D.C. Please give a warm welcome to Democratic candidate for CD5, Mark Heggestad.
Well, thank you, Michelle, and thank you to all you guys. I just want to say, you guys are what makes democracy work. So I appreciate you guys all being here. I am just tickled to be here, so thank you again. So I'm Mark Heggestad. I'm running for Congress in CD5. I'm running as a Democrat, and I'm running to bring trust back to Washington and make our lives more affordable. So Michelle talked a little bit. I grew up in Minnesota. I grew up in a Lutheran family where I was adopted. I will tell you that my parents were druggies. They drugged me to Sunday school. They drugged me to church. They drugged me to confirmation. And so, you know, growing up in a small town, you learn a couple things. One, you learn the golden rule, and you learn to love thy neighbor. And those guideposts have kind of guided me my whole life. So I went to public school. I went to state college. I've got 2 degrees, one in MIS and one in business management. So believe it or not, I'm an IT project manager. So my last job was at Mayo Clinic. I worked in rare disease, and I also worked in rare disease and genetics and big data, and I also worked with AI, and I also am a football official. Michelle talked a little bit about that. I work with the Jaguars. I do high school and college. So you guys want to talk about football at all? You know, OTAs are on Tuesday, so excited to see the Jags out there again. But yeah, a couple of my values. I believe the economy should work for everybody. I don't care where you come from or who you love. We all deserve dignity. The Constitution matters. And one of the reasons I'm running, and the reason I decided to make this move, was that watching the president sign executive orders on his inauguration day, I knew he had an autocrat coming at us in a big way. All of his executive orders are illegal, unconstitutional, not within his powers, and he has no money to pay for anything. But yet, here we are. This last week has probably been a little head spinning for everybody, so breathe. We'll be fine. But it is, we are going to need to put up a really good fight against him in the midterms. And we will. I'm very confident the fall is going to be a lot of fun. So get out there, watch some football, go protest. More football, go protest. But a couple other things about me. I believe in immigration. We need to develop pathways for people that are here. If they're here, they're following the rules, they're contributing, let's make them a citizen. Let's do everything we can to help them out. What we're doing to them now, and alligator Alcatraz, is terrible. It's hard to read. I've read through the Amnesty International report, and boy, that just breaks your heart to see what the people of Florida are doing to other human beings. And so we will stop it, but hopefully sooner rather than later. But yeah, think about it. We got to get pathways for everybody and just make everybody legal. Healthcare. After writing the bill to make sure All presidential orders are legal, constitutional, and within his Article 2 powers. Number 2, close number 1, is healthcare. We need to implement a national healthcare plan. I think the country's ready for it. Maybe they weren't quite ready for Obamacare, but we need to implement a national healthcare plan. And that involves taking the time to talk to everybody, make sure that doctors and patients agree on the plan, employers and insurers can agree on a plan, research, VA, get everybody involved, come up with the model, and implement it when we take power after the midterms or when we get the next president, who will be a Democrat, by the way. Let's see, I got a couple topics here for you guys. Voting rights. So we know the SAVE Act is not good, but if you ever talk to somebody about the SAVE Act and voting rights, just say it like this. When you protect voting rights, you protect all of our rights. So don't give that away, thinking, oh, we got to have ID. Say, no, just say, we protect voting rights. You know, believe it or not, we'll protect gun rights, free speech, all of the Bill of Rights are protected when we protect voting rights. So don't be scared to get in that conversation for sure. What's the next good one? Gun violence, obviously. Florida has a lot of guns in Florida. They're part of the Second Amendment, but you have to, if you're going to own a gun, you have to own it responsible. You have to be responsible. That includes potentially banning AR rifles. I'd be all for that. I'd be for doing some kind of a liability insurance, because if your gun hurts somebody or something, you have a way to pay for it. But yeah, I would like to see guns off the street for sure. There's just too many. But that's a tough get in Florida. But we can do a lot of stuff to make our lives safer and our streets safer as well. All right, you guys ready for some questions?
Anyone with a question?
All right, what is your knowledge of the challenges in special education in Florida, and how will you represent those challenges at the national level? Lower cost, what does it say, lower cost? Sorry, that was my terrible Caseloads, okay. And behavior support. Yeah, so long time ago, special ed was integrated into public schools, and we have to continue that. Do they need funding? Of course. I'm guessing you have some expertise in this?
Yes, this is my 19th year as a special education teacher here in St. Johns County in a public school.
Yeah.
I'm a fierce advocate for them because they can't speak for themselves. I speak for them and I speak for my colleagues as well. And I know you always hear, oh, up north. I actually worked up north and up north and up north, and I want all the children of our country to have the same access. I want all the special education children of our country to have the same access to services and a free and appropriate education. Florida is not at the top of that list by no means, but I think fully funding IDEA for sure will help, but still Florida needs a lot of work in that area.
Yep, and when there's a special education student in your class, the classmates will step up usually and help them out in any way they can. They're pretty resilient kids. Kids are pretty resilient, and they will help out. And maybe maybe you can say that's true or not true, but I've seen it myself. So, growing up, I had a special ed kid in my class, and I would go lift weights for football, and part of my, I don't know what I get. I think they just asked me, just bring him down there with you and lift weights together. And he was in a wheelchair, and I helped him with his strength and stuff like that. So, yeah, anything that you think is short, I would love to hear about it, and I absolutely will advocate for that. I've seen it. Sounds good. All right. How do you anticipate a national health plan will affect private healthcare companies? I would say, they will be affected, but they'll have to be part of the solution for sure. First of all, they'll have all the infrastructure. So where they'll be affected the most is the profit margins. Will probably go down substantially for them. I think there's plenty of room for private insurance for different things. For example, executive care and stuff like that. There'll be a room for that, and maybe to fill in whatever the national health care plan doesn't provide. But they'll have to be involved for a long time. But the first part is to pick the model. The second part of rolling this out is to stabilize costs, and they would be the first people affected by that for sure. But they'll also be part of the solution too, because we're not going to switch on a dime. So it'll take, I think, from the time you pick a plan and start rolling it out, it'll probably be 2 to 5 years after that, if not longer. So, okay. Oh, more? All right, I'll tell you a funny story. When I started at Mayo, I had to take an eye test, and I took it without my glasses. And I told the doctor I was a football ref, and I failed the test miserably. And she goes, "How in the world do you call football when you can't see anything?" And I said, "Just call the big ones." Reproductive rights. So easy one. We need to reinstate Roe v. Wade, straight up. I believe that when you start a family and your future is up to a woman and her doctor, we need to stay out of the clinic and stay out of that discussion. We need to protect women. It's healthcare, straight away. Thank you. Are you familiar with mom's demand for action for gun safety? A little bit. Tell me more.
So they're a group in, actually, Sully could probably tell you more.
Sully behind me can probably tell you more because she's an advocate, but they are endorsing candidates right now. And what they're trying to do is have common sense safety for gun, and they're really cool organization. They spoke at the SAB Dems a couple months ago.
Okay.
And I bet Sully can send you some information or speak
Yeah.
more on it.
I would love that. Like I said, it's all about common sense, right? Growing up in a small town, everybody hunted. It wasn't any big deal. I love trap shooting. I didn't really like hunting. But if it didn't have a ball, it wasn't a sport. So I didn't really get into that too much. But I would be for mandatory gun safety training to own a firearm. You shouldn't just be able to go buy one and wear it on your hip and walk into Walmart. This doesn't seem right. So I would be for that, and again, for liability insurance. If you own a gun, you are responsible for everything that gun does. When you pull the trigger, you got to know where that bullet is going to stop. These were the basics that I learned when I took gun training, and I think everybody needs to have that. So, thank you. What can be done to reduce insurance burdens, homeowners especially? So the number one reason homeowners insurance is expensive is this thing called reinsurance. And basically that is where insurance companies buy insurance for themselves. So when they write 20 different policies and that neighborhood gets hit, that would wipe out an insurance company. So they actually buy insurance for that catastrophic incident, right? So Florida has a catastrophic insurance fund, and that needs to be expanded. Expanded to the point where we can push that cost down, because that'll come directly back to the homeowner and the cost of insurance. And basically you're spreading the risk. And you could do right now Florida has it, but we should do it through all the southeast, minimally. And then we need to attract all of the insurance companies back to Florida, all state, all of them. Get them back in, get some competition, because I don't know about you guys, but I got some weird insurance company that does. We have it, but I'd be scared, because a lot of times what they'll do too after an incident, they'll pay some piddly little bit and make you sue them, and that shouldn't be. You should, when you file a claim, they should be able to do it fairly quickly and get you going again. So that's who asked that? Did that?
I was wondering if there were just some practical steps that you could recommend, and this catastrophic fund sounds like a good place to start.
Yeah, yep. Get that reinsurance cost down, because they have to buy it, for their protection. And when that's not competitive, then it comes right to us. So, all right. What is your view about government's role in protecting workers from AI-related job losses? Okay. AI. Well, I've managed AI, and so I get how it works. As far as the job losses, I don't know. When we got the internet, we thought that would be the end of jobs for everybody. We worked through it. So I think there will be some of that. I think there will be a shift in what we do. But I also think if a company is has the ability to give you another job or retrain you because they're replacing you with AI, they should take those steps. And we should, as part of their laying them off, their costs, they should be able to retrain you and protect the workers' rights. But AI is here to stay. The other thing with AI is when you use it, you should know what you're getting back. So they should publish the model, how it was trained, who trained it, how it was tested, how it's updated. There's also something called responsible AI. So just like when you go to the airport, you get your baggage checked on the way out, and you get your baggage checked on the way back. And so what responsible AI is you have that ability that whoever's running that system can put in rules so that you don't necessarily put something in that is harmful to you or others. So you'll notice that at work, if you ever use it at work, when you say something, it'll come back and say, sorry, can't help you. But that's exactly what those responsible AI rules do.
So what about these massive data centers?
Yeah, the biggest thing with the AI data center is when they come in, they use public electricity and water and stuff like that. So every community should decide if they want that in their community, number one. Number two, they should, if they're going to bring a data center, they need to somehow provide their own electricity through generators, through whatever means they need to do. Because they can't make our rates go up at the end of the day. They're not necessarily harmful until they do that. Make us pay for their data.
Also destroying our water table.
Right, exactly. Yep. They can't, if they're going to be coming into our community, they can't be hurt. They can't do harm. So they're hard though, because they're getting permits with nobody knows that they're going in, and they're breaking ground, and all of a sudden they're there. And our electricity, the national rate for a kilowatt is about 9.5 cents per kilowatt hour, and in Jacksonville it's like 16. So it's a pretty good gouge. Yeah.
We have more questions than you
Wow.
have time.
Oh, awesome.
So, if you could possibly take 2 of those?
Yeah.
And then afterwards, are you going to stick around?
Yeah,
Then
absolutely.
you can meet with people individually, or they can put their names on it, and you can get back to them, because, I don't want to max out on my time.
No.
Thank you.
Just give me the hook. All right. Elaborate on specifics on affordability. So, you know, we were getting, our gas prices just are number 2 after tariffs. American citizens paid 90% of the tariffs. So no matter what you heard on TV or what somebody said, we're going to make China pay, no, we paid it. And that just goes right out of our pocket. The other thing, like I said, electricity, 16% or 16 cents per kilowatt hour. We can get that. That needs to go back to 9, make it to a national average. Gas. So the weird thing about Brent crude oil, if you guys probably know how this works, but it just sets the rate. It's the index for setting the price of oil. Well, guess what? In America, we make enough oil for all of us, right? We export it. We have more. So when they blocked the Straits of Hormuz, it didn't affect our oil production at all because we make our own, right? Or we drill our own. But guess what? They hiked the price. They doubled it anyway. And guess where that profit went? It went straight to the oil companies. They didn't have any other expenses except for they just took all the profit, and it's coming from us. So that's definitely got to change. Yep. Talk a little bit about housing affordability. Maybe not so much here, maybe, but there's a lot of companies that are buying up all the houses, and then, yeah, they're buying up the houses, and then what they do is they buy up the houses, get renters in, and then they sell the houses. They advertise, hey, I got income, revenue generating housing. Here's what I can sell it for, and then they sell the house. The next person takes that money and jacks up the rent some more. So it's not good if you're a renter at all. So. Any other specifics that you want to hear about on affordability? That was it? Okay. If you got more, let me know. Are we done? Okay. Thank you. Yeah.
Yeah. Mark says he's going to stick around. So if you have more questions for him, because he wasn't able to get to them all, please meet with him afterwards. Thank you. Thank you so much.